The law is changing. The Care Act is coming. The Department of Health are reforming adult social care.
Why are they doing this?
Well, the government wrote a white paper called Caring for Our Future. It explains how older people and people with disabilities, mental health needs, and carers too should be supported and cared for by county councils like Surrey. It says that people should be supported in ways they choose, a very personalised service. People should have care that meets their needs. It should be planned well and meet agreed outcomes. Support should help people stay independent. It should be preventative. The government needed a law to make their ideas become real for people who live in England. This is the Care Act. The Act replaces lots of other care laws. Many were old-fashioned or confusing and needed to go. Importantly, the Act tells people how their care and support should be paid for in the future. In Surrey, we already work in lots of ways that meet the requirements of the Care Act. We have carers' personal budgets. We support people to have direct payments, to plan and organise their own support. We have deferred payments, allowing people who fund their own care in residential homes to pay for it after they've died. But there is still more to do, so Surrey County Council have put together a team of people to make sure we get it right. Assistant Director John Woods is working at the Department of Health, providing advice to those who are writing the instructions to go with the new law, and working groups made up of senior managers, social workers, information and financial specialists and people who use services and their family carers.
What must they make happen?
The Act says local authorities like Surrey County Council must work to ensure people's well-being is at the centre of everything they do. The council needs to be ready to provide support or information to all sorts of local people. This is called universal support. Well-being means all people, including carers, should feel happy about the way they are supported. They should feel safe, feel that their needs are being met, and that they can make their own choices day to day. Well-being is different for different people. The Act gives carers the same rights as the people they care for. Some people will only need advice or information. Others may need care. If they are a carer, they may need support to care for someone else. And it is the council's responsibility to make sure there are lots of good quality options for people to choose from. To make this all happen, the council and other organisations are going to have to work together. Organisations like the NHS, the police, public health or housing departments. The Care Act makes this law. The Care Act also says the council must work with its partners to prevent, delay or reduce people and carers' needs for support. This includes better connecting people to support through their families, friends and communities. It brings in the right to an assessment for anyone, including carers, who may need support. These assessments will look at people as part of their family and their community. It will assess the person's needs for care and support and look at what support they already have. They will check how much money people have to help pay for care. Who is actually able to receive care from the council will be worked out using an eligibility criteria. Any needs a person has that have a big effect on their well-being are eligible for support. For the first time, the level of need that triggers support will be the same across the country. People will have a legal right to a personal budget and the right to choose whether they or their carer wish to receive this as a direct payment. There will be more targeted support for families and young carers. We provide services for these groups in Surrey already, but are still looking at how we can improve. People who are not entitled to financial support from Surrey, up to now, usually sort out their care themselves. The Care Act says these people can now ask the council for help to plan or make arrangements. For people living in Surrey as ordinary residents, that is, not living in care homes, who don't have their own money but do have eligible needs, the County Council can provide them with support services. The County Council must also support carers if they have eligible needs. And the new law says that if the person moves out of Surrey, the local authority where they move to must carry on providing the same level of care until they complete an assessment. This should help people to move house, maybe closer to their family, without needing to worry about losing their care. Adult social care teams will need to work closely with services for children. They will need to make sure, as children become adults, the planning is in place well in advance for a smooth transition. The teams will also support carers and parents through this process. Advocacy will be available for people at times of assessment, support planning or safeguarding when people may be at risk. Keeping people safe is going to be important, and the Surrey Safeguarding Adults Board is already very active in Surrey. We will be checking it is organised in a way that meets the rules in the Care Act. The Council, with the help of the Care Quality Commission, will have to keep an eye on big organisations that run lots of care homes, so they can be aware early on of any changes or closures to services. If this happens, the local authority has a responsibility to keep everyone receiving support safe and that one way or another their care can continue. Professor Dilnot led a commission looking at the best ways for people to pay for their care. His recommendations are part of the Care Act. These changes in funding are complicated. People who are not entitled to financial support from the authority will be told how much they will have to pay towards their care costs in advance. This is called the cap on care costs. After they reach the cap, the authority will pay for care and support costs to meet their eligible needs, but a person may want to pay a top-up for additional services. People living in care homes will be expected to pay for things like food, rent and electricity if they can afford it. This will not count towards their cap. Also, people who live in residential care and who also own their own home may be entitled to financial support from the authority, depending on how much money someone has in savings. The Care Act is the biggest change in care law in 60 years. By 2015, most changes will be in place. At the moment, the guidance is in draft, so some of these things may change. And by 2016, the final arrangements for fundings will be ready to go. We will be communicating lots more about the changes to residents, carers and staff over the next few months through a range of different methods. If you'd like to know more, link to Department of Health online Care Act fact sheets. Visit our website www.surreycc.gov.uk/Care Act or contact careact@surreycc.gov.uk.